Now, this year has been trickier than any other, and trying to navigate all the changes has been really hard on everybody in all ages. And well, what about those kids, too? We want to talk to Dr. Dustin Monroe. He is the medical director of Mountain Star Children's Services. And Dr. Monroe, this year, where do you even begin, right? So, how did parents go about this, keeping their kids social, but also trying to minimize the COVID risks?
Yeah, there's been a lot of questions. We get this every day. What is the risk of children spreading it to other people? There's
Right.
been some studies that shown that children do spread it to adults, so there is a chance of that. But by and large, children are at lower risk, and they're not spreading it as much as the adolescent and adult population are spreading it amongst each other. Children have
Okay.
40% of the time, they're asymptomatic. And so we want kids to be able to engage in the community as much as
Right.
possible. And this is what we want to be able to share with parents, is that they can navigate that a little bit.
So I guess my question to you is too, if parents are wondering, do I allow other kids in my house right now? Do I just only let them do a Zoom conversation with friends? How do you go about deciding?
Yeah, I actually really appreciate what the governor recently said, that people need to mitigate their risk a little bit.
Mhm.
Everybody has different risk profile when it comes to coronavirus. And if you have good communication with other families and kind of decide what's best for you guys, maintaining good physical distance, hand washing, surface cleaning, wearing
Yeah,
masks when social distance is not possible. These are things that can help allow people to engage and still have some smaller activities, not big
right.
activities, but be able to engage a little bit in the community.
Now, Dr. Monroe, what have you seen with the mental health with kids? I mean, I know it's taken a toll on me this year. What about the kids that you're dealing with?
Yeah, we've seen an uptick in the number of kids who have committed or attempted suicide. We've seen a
Hmm.
lot more anxiety and depression. I was just
Hmm.
on a phone call with other medical directors, such as myself, across the country, and every single one of them told me that they're seeing an increase in the number of kids who've overdosed on medications or tried
Geez.
other self-harm techniques because their livelihood has been taken away. Their social groups are fragmented. They're not able to connect as much. And they're so engrossed with technology to occupy their
Mhm.
time that they're feeling a lot more depressed and disconnected from society.
Now, if parents have questions, tell them about the chat that you have on your website.
Yeah, so mountainstarchildrens.com is a great place to go to find out what our services are. We have an array of children's services, everything you can think of. And there's actually a little box in there you can submit a question. If you'd like to interact with us, I answer a lot of those questions, and we'd be happy to communicate with anybody that has any specific needs.
Perfect. Well, Dr. Monroe, thank you so much for covering such an important topic today.
Absolutely, anytime.